Alright, so sheep heart. It's about the size of a fist. Give it knuckles if you want. Human heart's a little larger than a sheep heart, because sheep are a little smaller than a human. Depends on what size of human as well. Heart contains 4 chambers. Right and left atria, right and left ventricles. Left ventricle obviously much larger. This is in fact not an atria, and this is in fact not an atria. These are parts of the atria, flaps, that assist with pumping blood and storing blood, called auricles. We'll only be able to see the atria when we actually open up the heart. This right here is a coronary artery. Down here are coronary arteries embedded in this fat. Coronary arteries are what actually deliver blood to the heart muscle. The heart is filled with blood, but it actually doesn't have access to much of that blood. It's got to pump it out and then back into the coronary arteries for it to be dispersed across the heart muscle. Ventricle, much larger, much thicker, extends all the way down to the apex of the heart. The apex of the heart is the bottom. Normally we think of apex synonymous with pinnacle, which is usually at the top. In the case of hearts, the apex is at the bottom, but still is where it comes to a point. All right, for my materials, I have my dissecting tray, I have a probe that I've been using, I have a scalpel, as well as a more complete dissecting kit. Don't have a ruler, I'll be skipping the measurement portion of this. All right, so finding the apex of the heart. Apex is actually at the bottom of the heart, as your guide shows you and as I'm telling you now. This would be an incorrect way for the heart to face. I imagine intuitively most of you would recognize that this is not the case. This is in fact the way the heart should face. If you flip it like this, you're looking at the back of the heart. The way you can tell most assuredly that it is the heart is this intraventricular ridge separates the 2 ventricles. Intraventricular separates 2 ventricles. I'll look that up before I do the voiceover. This left ventricle is much larger. Keep in mind this might actually be on the right side of your screen, but we always treat it as though the person is laying down facing upward. So this patient is on our table, that means that they're flipped from our perspective, and this is their right side and this is their left side. All right, now we're going to take a look at some of the exterior features before we actually cut into this. The next video we'll actually look at the exterior features, or the interior features. So, first thing we're going to do, coronary arteries. So, right here, intraventricular sluices has the different coronary branches of the coronary artery. This is the right coronary artery. This is the left coronary artery that feeds this left ventricle all of the blood that it needs. Next, we're going to find the pulmonary artery. The pulmonary artery starts in the right atrium and transfers blood to the lungs. This is the opening for it. It would actually branch and one would go left and one would go right to the 2 different lungs. But just to show you, this probe will, and you can see the probe sort of moving down and up, and it ends up in this right atrium. I can feel it pushing up against the right atrium. So here's our heart again. Here's our left ventricle, our right ventricle, and our right atrium up here. And this is fully implanted in the right atrium. So this is our pulmonary artery. Okay. right atrium dumps blood into the right ventricle. Right ventricle pumps blood out the pulmonary artery to the two lungs, and then it'll dump back in our pulmonary veins. We're going to look at superior and inferior vena cavas next. So this is our heart. The superior vena cava brings blood from the head and chest and limbs. The inferior vena cava dumps blood in from the legs and torso. So we're actually going to flip the heart just a little bit. Here is our superior vena cava. You can see that it just ends up right here in this little pocket, which is our right atrium. So again, looking at the heart like this, superior vena cava comes in and dumps right in here. Inferior vena cava is this little vessel right here. This little vessel just twists up and ends up in the exact same right atrium, right up top there. And so these two, when I cut it open, actually meet. Superior, slippery, superior vena cava, inferior vena cava, and both of them end up dumping into this right atrium. Okay, so I'm going to go ahead and stick my finger right in through here and have it squeeze out the inferior vena cava. Okay, so in the superior, again, here's our heart. If I turned, I would end up right up here in this pocket. See, I can make it waggle. It's the right atrium. But if I turn the other direction, then I come out the inferior vena cava. So they are, in fact, both dumping in to the same atrium. All right. We're also going to look at the aorta and two branches of the aorta. So here's our heart, left ventricle. The left ventricle pumps blood out the aorta, and so this is our aortic arch right here. There are two openings to the aortic arch. One right here. You can tell that this is a part of the aorta because as I gently retrace this vessel's path, it can go all the way down into the bottom of the heart down here, and you'll see as I pull it out, I was at the very tip of the heart because that left ventricle goes all the way to the base of the heart. There's a thick muscular wall there, but I can go almost all the way down. So that's this section. There is also a second opening right here. And if I go ahead and do the same thing and get all the way down to the very base of the heart, which is this left ventricle. So then I'll pull that back out just to show you. It goes all the way down at the base of this heart in that left ventricle. And then to demonstrate that these two are linked, rather than going down, I can simply go back up. Go down this one. And out this one. So they are a part of the same arch. Again, left ventricle pumps blood out the aorta. This is the brachiocephalic artery. And this is the continuation of the aortic arch that would go around and go down right behind the heart and feed blood to the rest of the body. So lower limbs.